When I spoke last year, I put a slide up that is basically the top left part of this slide, asking whether the target for Enfortumab matters, so Nectin-4 expression. And that had come from data where people had looked at paired biopsies between the primary and the metastatic disease and showed that there was sometimes discrepancy with whether or not there was Nectin-4 expression. So you almost always see it in the primary. There was a suggestion that you maybe don't always see it in the metastasis. And some retrospective data that suggested perhaps that might relate to outcomes with Enfortumab. So there was data at ESMO 2 weeks ago which undercuts that to a degree. The first thing to say is that about 250 of the patients in the trial had submitted a metastatic rather than a primary sample. And in those patients, there seemed to be exactly the same spread of high expression of Nectin-4 that you would see in the primary tumour, perhaps not matching with what previous data that we'd seen. But of course, these weren't paired biopsies, so you can't really interpret it in that sense. They cut this up in various different ways, but what it seems to show is that the H-score, which is basically a way of looking at immunohistochemical expression that combines the the intensity with the percentage of patients that express the target. No matter what the score is, it didn't seem to matter. Everyone benefited from EV-Pembro. So at the moment, it doesn't look like Nectin-4 is a predictive biomarker for benefit of this treatment. And as good as this data now is, people still progress through it. We are still going to have people that don't respond to this treatment. We're still going to have to think about what we do with them. So we should still ideally want to be able to select for this. But at the moment, it's a treatment for everyone.